So first off, I'll be demonstrating the elbow joint plays. For elbow joint play, your patient will be supine on the table. Our three types of elbow joint play are humeral ulnar, radial ulnar, and radiohumeral. So we're going to do this first is the humeral ulnar. So here we're going to have our patient laying supine, elbow flexed about 70 degrees of flexion, with the forearm supinated to about 10 degrees of 10 degrees supination. We're going to hook the forearm in our arm, find the head of the radius in the ulna, and apply a distraction force, pulling down and up, kind of scooping the fossa. So same thing, I'm just going to do that again. It's like that. Next, we got the radial ulnar. So same thing, patient supine, elbow flex to 7 degrees of flexion. This time we're going to do though is have their forearm supinated to 35 degrees of supination. So same thing here, so 35 degrees, hook their arm again. This time, find the radial head, and instead of applying a distraction force, we're going to be moving the radial head, just deviating it anterior and posteriorly. And last, the radiohumeral. For this one, patient's forearm in full extension, in full supination. Let's go over a little bit. And we're going to do here the same thing. Find the radial head and the ulnar head, and just same thing, just apply that anterior and posterior force, testing the joint. Positive tests for this are going to be hypermobility, hypomobility, or pain. Doing the varus and valgus stress tests. So the valgus stress test will be testing the UCL, the ulnar collateral ligament. The varus stress test will be testing the radial collateral ligament. Positive test for this is increased laxity would show a sprain in the UCL or the RCL. First, we'll be doing the valgus stress test. So for both of these stress tests, we're going to be supporting the olecranon process, kind of the back of the elbow, humerus area, as well as the distal forearm by the wrist. We're going to have, for the valgus stress test, we're going to have their hand, the elbow flexed to 25 degrees of flexion. We're going to apply the valgus force at the elbow, pushing this way. We're going to have the patients be passive. Like I said, positive test for this, increased laxity in the UCL. So then the varus stress test, same thing, about 25 degrees, supporting here. We're going to be pushing in the varus force this time, pushing out. And then there will be no pronation or supination at the wrist. It'll be in neutral position. All right, I will be demonstrating the moving valgus stress test now. So for this test, we're testing the UCL again. Positive sign or positive test would be pain at the UCL with the motion. So here, we're gonna have the patient abduction, 90 degrees. We're gonna have them externally rotate in full flexion. We're going to palpate the medial epicondyle, and with this motion we're going to be applying a valgus force and extending the arm. So we'll have him just be straight, abduction, fully flexed here again, palpate, externally rotated, the valgus force with the extension. And pain at the UCL would be a positive test for a partial UCL tear. I will be demonstrating the posterior lateral rotary instability test, looking for chronic instability. Positive test here will be subluxation of the elbow. What we're going to do here is have the patient laying supine. We're going to have them flex the shoulder 90 degrees, flex the elbow to 90 degrees, and supinate the forearm. We're going to be adding a valgus force here at the elbow and an axial load while we extend, and we can bring it back into flexion. So the valgus force and the extension here. And if the elbow subluxes, it'll be positive for chronic instability.